Hi, my name is Esme Antonakakis, and here's my badge. Okay. Hi, Mia. How are you today?
I'm good. How are you?
I'm great. Thank you so much for asking. Mia, my name is Esme. I'm one of the health educators. I'll be assisting you for our appointment today. Before we begin, I do want to let you know our appointment will be a conversation. I do encourage you to ask questions. Curiosity is best. I do want to make sure that I give you all the information you need to make the best decision for your health. And also, I do want to let you know our confidentiality is very important. So everything we discuss is confidential, meaning we won't discuss it with anyone else unless you tell me that you are hurting yourself, hurting someone else, or somebody else is hurting you. Do you have any questions about confidentiality?
Mm-mm.
Perfect. So let's go ahead and begin. If you could tell me a little bit about the reason for your visit today.
I am looking into starting birth control.
Great. Amazing, Mia. And have you ever used anything in the past?
I have not.
Okay. And do you have any children?
I don't.
No children. Any plans to have children further out in the future?
No.
None. Okay. So what I'm hearing is that you want to prevent a pregnancy.
Correct.
For long term, a long period of time. Great. And anything else that you are looking for in your method?
Something that doesn't have a lot of side effects.
Lots of side effects. Great. Perfect. So anything else that I should know of regarding your health?
No.
Okay. Great. So let's go over the methods that we offer here at the clinic. I'll give you an overview. Please stop me at any time with any questions or concerns, and we will go from there.
Sounds good.
Mia, so the top tier are methods that work really, really well. They work for long term. Some can be used for many years. There's the arm implant that prevents pregnancy for 3 years. Has one hormone. Then there's 3 IUDs that are hormonal. So they prevent pregnancy from 3 years, 5 years, and 8 years. Then we have the non-hormonal copper IUD that is good for 10 years. And permanent sterilization, male and female, that is forever. It's non-reversible. With these methods, 1 out of 100 people can become pregnant every year. So they work very, very well at preventing pregnancy. Do you have any questions on these?
No.
Awesome. Next, we have the second tier. These methods work pretty well. It is important to use them correctly as they are supposed to in order for them to best prevent pregnancy. For example, there are birth control pills that you take every single day. The pills have 2 hormones, progesterone and estrogen. We also have a patch that is used on your skin, and you can place it on your arm, sometimes on your back, and that one you change it every week. There's also a vaginal ring that is good for you change it every month. And then there is the depot shot that you come into the clinic every 3 months. That one has 1 hormone, progestin. And these methods, 6 out of 9 out of 100 people can become pregnant on these methods, but they still work very well when used as work properly. And do you have any questions on any of those? No? Great. And lastly, we have the third tier of methods. We have these that they don't work as well, but they can still be used as methods to prevent a pregnancy. For instance, there is the withdrawal method, which is the removal of a penis upon ejaculation from the vagina. We have fertility awareness, where you can track your cycle. So you track your period every month, And there's many apps that you can use to track those your cycle. There's also condoms, internal condoms, and also external condoms. And with those, none of the birth control methods protect against sexually transmitted infections. The best way is any barrier methods, such as internal or external condoms. Any questions on that?
No.
Awesome. And Mia, if you could tell me, what are the birth control methods that go in the arm?
The implant.
Great. And is the birth control pill hormonal or not hormonal?
Hormonal.
Yes. Great. Awesome. And is there a method that interests you at the moment that you really catches your attention?
The implant sounds interesting.
The implant? Great. So as before we go into the details of the implant, I do want to let you know, in the case that there is any unprotected intercourse at any time and you haven't started your implant, there is a second chance to prevent pregnancy. So there is the IUD, the Paragard IUD, that can be used. Copper is a natural sperm diffuser, should say, and that you can get it inserted within those first few days after unprotected intercourse. There is also Plan B that you can take within 3 days of unprotected intercourse, right? And Ella, which you can get from your doctor. It does require a prescription. It needs to be taken within the 3 days after unprotected intercourse. Any questions on those?
I don't think so.
No? Awesome. So, Mia, before, let's go ahead and talk about the implant. So, the implant is a small device, a little plastic bendy, if you want to feel it, kind of get in touch with it. It goes underneath your arm, under the skin. This is a model that you can feel a little bit what it would feel like when it is inserted in the body. And as I mentioned, the implant has one hormone, progestin, and that is what prevents a pregnancy. So let's talk a little bit about how a pregnancy can happen. But before we do, could you tell me the arm implant, how many hormones does it have?
1.
Mia! One.
Also, was it 3 years or 5 years for the Ella?
Oh my god, I
'Cause you
don't
said 3.
know.
You said 3 and it said 5 online.
Why am I confusing those? My other chart has the emergency ones back here.
Let's cut the video at some point and then like continue it and then
That's
like
what I was
add it.
thinking.
Yeah. Do you want to like start from that part where you were talking about Plan B and Ella?
Yes.
Okay.
Yeah.
Okay. That's why like when you said that you're like, do you have any questions? And I was like,
You're doing it wrong.
No. Yeah, because I didn't want to. Yeah.
No. Yeah.
Yeah.
Semi-emergency contraception is a second chance at preventing a pregnancy, but these methods do have to be used within a certain period of time. There are 3 options. There is the Paragard IUD, which is a copper. It's in the shape of a T, kind of like this one, but it is made of copper. That one you can have it inserted by your provider as soon as possible, but within 5 days of unprotected intercourse. And also there are 2 pills. One of them is Plan B that should be used within 3 days, and Ella that can be used within 5 days of unprotected intercourse. If after using them you think you might be pregnant, please do contact your clinic. But let's talk a little bit about our female anatomy and how a pregnancy can happen. So we have our ovaries right here and our fallopian tubes. The fallopian tubes are connected to your uterus. That is usually where you carry a pregnancy. Every month, your ovary releases an egg that travels through the fallopian tube. If there is any sperm in the vaginal canal that has entered the uterus, if it meets with the egg, implants in the there's an implantation that happens in the uterus and a pregnancy happens. And Mia, did you know that sperm can live in the body for up to 5 days?
Wow, I did not know that.
Yes. And so, because it can live in the body up to 5 days, when can you get the Paragard IUD after unprotected intercourse?
Within 5 days.
Yes, correct. But as soon as possible.
Yeah.
You don't want to wait that long, but you do want to get in as soon as possible. So the implant, since it has the 1-progesterone hormone, what the hormone does is that it creates a thinning of the uterus, the lining of the walls, and it creates a cervical mucus that is sticky and makes sperm more difficult to move upward. Therefore, pregnancy is harder for to occur. Any questions?
No.
Great. And with the arm implant, Mia, it is good for 3 years to prevent pregnancy if at any point it is not a method that is working for you. If the side effects are too intense, just know that you don't have to continue on that method. Please call your clinic and they can schedule a removal and offer you a different method. Some of the side effects included for the arm implant are very minimal. They are not life-threatening, but if they do happen, usually as your body's getting used to the method, to the hormone, they should subside within the 3 months. If it does continue and it's bothersome, please do talk to your doctor. Some of those side effects can be headaches, tenderness of the breasts, sometimes spotting in between periods. Do remember that with the implant, sometimes your period might be, there might be some changes to your period, meaning lighter periods or completely not having a period at all. How is that something that would bother you? No?
No.
Okay. And Mia, how many hormones does the implant have?
1.
And how many years is it good for?
3.
Awesome. Yes. Awesome, Mia. And any questions at the moment? Any concerns about the implant?
Nope.
No concerns? Great. So is the implant a method that you might want to use?
Yes.
Yes. Great. So next, I'd like to go over what the procedure may be like. So they will schedule you an appointment with your doctor. They will do a pregnancy test. Every time you start a new method, they do a standard pregnancy test before insertion. They do ask that you abstain for the first, for 14 days before the insertion. At your appointment, they will clean the area around the arm, make sure that it's well sanitized. They inject you with the anesthesia, which numbs your arm, and you should feel some pressure upon insertion, but usually the most painful part is the injection of the anesthesia. Any questions?
Nope.
No. And Mia, how do you feel about getting the arm implant? Is that something that you think you might want to use long term?
Yeah, That sounds like a good option.
Yes. And do you remember what you can do if it's not working out for you, if you don't feel well on it?
Yes.
What do you want to do? What are you going to do?
Schedule an appointment for removal.
Awesome. Thank you. Yes. Excellent. Now, Mia, before completing, I do just want to let you know any warning signs that are very rare that can happen on the implant can be if you have any swelling or pus is coming out of the insertion site. You do want to let your doctor know right away. Those are signs of infections, and you want to come back to the clinic. Later on, if you are continuing to spot in between periods or having heavy bleeding, please do contact your doctor as well. We don't want that to go long term. Does that sound good?
Sounds good, yes.
Great. All right, Mia, let's go ahead and schedule your appointment. Thank you for coming in.
Thank you.